Still good morning. On behalf of all the talented staff at Phoenix Children's, we want to thank Greater Phoenix Chamber and respected panel of judges for this award. This is not recognition I take credit for. Dedication to Innovation is an organization-wide initiative at Phoenix Children's, and our entire staff is committed. Joined by me today are a group of hospital staff who have personally contributed to so many of our patient-focused innovations and quality improvements in the few years. Some of these are examples: Quality Day, Research Day, where our staff had the opportunity to come forward and present their patient-focused ideas and quality improvement initiatives. And we actually incentivize staff at all levels to be their own problem solvers and solution developers. Staff of all ages and experience contribute to our ever-improving innovation, and really they're the ones that interact with our patients, families on a day-to-day basis and really understand better than anyone where we have areas for improvement. And our real goal at Phoenix Children is something we refer to as preventing harm. Hospitals are very dangerous places, so we try not to harm children. So as an example, Phoenix Children's has not made a single prescribing error in the last 7 years. This used to be our single biggest event of patient harm, so we eliminated it. This is because a team of clinical staff along with IT saw an issue, a disconnect that was occurring, and they fixed it. They found a solution rooted in tracking patient data. We can now analyze more than 1 million prescription orders and define thresholds for very high, dangerously high doses based on patient age and weight, and they create a system that alerts the prescribers, the physicians, when doses exceed a rate. Another innovation in patient care are iPhones that can scan and track patient medical record information up to the minute. Each nurse starts his or her shift with an iPhone. We built a barcoder into it, which is part of that pharmacy system, and they can go room to room documenting medications administered, etc. The added efficiency is tenfold, improved from days when nurses would make their rounds from patient to patient, return to a computer, and document it all. This left room for all types of errors, compromising integrity, etc. Again, clinical solutions sprouting and growing every day at the hospital. We keep rethinking patient experience and how we can improve patient care. iPads are now installed in every patient room at our hospital, customized to each patient's age and reading level. They only make appropriate content available and offer easy access to information about each patient's care, diagnosis, and upcoming procedures. And by the way, we did this very, very efficiently. The whole system cost us $250,000. The competitive bid from the industry leader was $1.7 million. Virtual visit cameras are video cameras we first installed. They allow parents and grandparents to see their grandchildren from afar. And they can see them in real time, even when they can't physically come to the hospitals. The camera, the patient satisfaction, family satisfaction has grown. We've been moved from the NICU to include all of our ICUs. So again, these are just types of advancements we've been making in children's health care. Some of them are clinically oriented, some of them are patient satisfaction oriented, etc. This September marks our 35th birthday, so we're glad to celebrate the advances we push forward. It gives us great pride to improve the standard across the industry. And when I say that, many of the systems that we're talking about I described are now in place at multiple other children's hospitals around the country. So Rainbow Babies, Mott's Children's Hospital in Ann Arbor, Michigan are using that dose range checking system. So in the ultimate, our customers, patients, families, thank you for continuing to choose Phoenix Children's for your children's care. And thank you for the great honor of recognizing our work in innovation. We couldn't do it without our huge network of supporters all around the valley and the state. Thank you very much.